Well, our final module is another short module that focuses solely on the drugs influencing the GI system. We will cover drugs to treat peptic ulcer disease and gastroesophageal reflux disease, or GERD, constipation, and nausea. These drugs have widespread use, and many of them are available over the counter. Module 10, you learned about opioids to treat pain. And if you recall, one of the major side effects of opioids is constipation. Failure to be proactive with measures to prevent and treat this can intensify the client's discomfort. Your nursing interventions will need to include educating the client to use a laxative that is the best fit for them. Laxatives or GI stimulants come in different types, have varied actions, and serve different purposes. For example, a laxative such as magnesium citrate is taken prior to a diagnostic procedure, like a colonoscopy, to evacuate the bowel as completely as possible to promote good visualization of the colon tissue. This is different than the drug metoclopramide, which stimulates GI secretions and motility to help the GI tract move substances through, such as the X-ray contrast medium barium, or to prevent nausea after chemotherapy. Conversely, antidiarrheal medications block the stimulation of the GI tract, such as by the direct action on the muscles of the GI tract, such as loperamide, to stop its hyperactivity. You will also learn about other drugs to prevent nausea, including prochlorperamizine. That is effective to treat nausea for clients undergoing anesthesia, and ondansetron, which can be very effective to treat nausea associated with radiation or chemotherapy and the postoperative period. This module will also include drugs to treat peptic ulcer disease and gastroesophageal reflux disease, or GERD. There are 4 different classes of drugs to treat these diseases and work in different ways to suppress GI secretions. They include the H2 blockers, cimetidine, antacids, or sodium bicarbonate, protein pump inhibitors like omeprazole, and those that act to protect the lining of the esophagus or stomach, like sucralfate. In addition, antibiotics are also used, such as amoxicillin and tetracycline, which you learned about in Module 6. In the past, it was thought that peptic ulcers were caused solely by excessive acid in the stomach after meals. In the early 1900s, a Wisconsin-born physician, Dr. Sippy, advanced that theory based on no acid, no ulcer, and promoted the practice of prescribing the Sippy diet, consisting of hourly milk and cream feedings and large doses of antacids. Well, thankfully, the treatment of peptic ulcer disease has come a long way, particularly due to the work of Dr. Barry Marshall and Dr. Robin Warren, who discovered that an underlying causative mechanism of peptic ulcer disease was the H. pylori organism. To prove this theory, Dr. Marshall carried out the experiment on himself by drinking a live H. pylori culture. He suffered severe inflammation of the stomach and gastritis, thereby making an initial linkage between H. pylori and peptic ulcer disease. Dr. Marshall and Dr. Warren were awarded the Nobel Prize in 2005, which has led to the treatment of peptic ulcer disease with antibiotics when cultures are positive. This is what evidence-based practice gets built on. Research.